All right, I would say we've plateaued. Let's get started.
Okay, sounds good. Good afternoon. Welcome to our Wings Minnesota webinar, Supported Decision Making and Guardianship, Which One is Right for Me? This is Jamie Majers talking, and I am the Minnesota Judicial Branch Audit Manager. I oversee conservator audit, account, and review programs for the courts. I am a white woman with long blonde straight hair. I'm wearing a black shirt today with a black sweater with the Minnesota Judicial Branch logo on it. I am sitting at my home in my home office, along with Anita Raymond, who you will meet more in a minute. She's also the co-facilitator of Wings Minnesota with me. Working interdisciplinary networks of guardianship stakeholders, Wings are part of a national movement for improving systems for supporting persons with disabilities. Wings groups are court community partnerships that seek to drive changes affecting the way courts and guardians practice and improve the lives of people who need help in decision making. Wings Minnesota seeks to improve guardianship systems and promote the use of supported decision making. Learn more about Wings Minnesota at wingsminnesota.org. Be sure to subscribe to our newsletter so you don't miss invitations for our future educational events. This training is supported in part by grant number 90EJ1G0019-01-01, Elder Justice Innovation Grants awarded in 2021 for improving guardianship from the Administration for Community Living, U.S. and Department of Health and Human Services. The Minnesota Judicial Branch was awarded the ACL grant in September of 2021. The goal of the Minnesota Judicial Branch with this grant is to ensure that vulnerable adults subject to guardianship and conservatorship in Minnesota are safe and well cared for. One of our 4 main objectives of this grant is to provide training on supported decision-making and least restrictive options to judges, guardians, conservators, interested persons, attorneys, family members, and court visitors. It is our goal and hope that we limit petitions coming into the courts, as well as increase petitions to terminate unneeded guardians and conservatorships. A few housekeeping items before we get started for this webinar format. All participants, you have your cameras and your microphones off. If you would like to ask questions or have comments and conversation, we encourage that. Please use our chat feature and then also the question and answers for questions. The captioning has been enabled. If you prefer to turn that off, you can go to your Zoom toolbar and utilize that to turn that off. If you have questions or need assistance, you can put that in also the chat and we will have someone assist you with directions. Handouts will be sent via email tomorrow, as well as an evaluation, a link to an evaluation. And we would appreciate your feedback. It's respectful for our speakers and our organizers to share that feedback. It also helps us with future presentations and helps us with Wings regarding opportunities for presentations. We'll be sending CEU certificates to attendees who attended at least 75% of the session. That will come out later next week. And we are recording today's session and that will be announced where that would be, the recording will be available later on. I have a great honor of introducing you our speakers today. We have Jean Hoff, Mary Hoff, and Anita Raymond. Anita, go ahead.
Thank you, Jamie. This is Anita talking. I am a middle-aged white woman with brown shoulder-length curly hair. And I also want to note that we have with us Kathleen Carlson and Alicia Wolf from our office at the Center for Excellence in Supported Decision Making. And they will be along with Jamie, will be here in the background helping with answering Q&A and responding to chat and anything else that might come up. So welcome and thank you also, Kathleen and Alicia. So as Jamie mentioned, we're here today as part of the court grant and for lots of other great reasons to talk more about guardianship. We're going to talk today about the statutory requirements for guardianship, which inform petitioning considerations. And this will include an overview of why it's important and how states, systems, and best practices are looking differently at guardianship. We're going to talk about the promise of supported decision making and how to decide what's the best in your situation. And then Jean and Mary will share their personal experiences with supported decision making. So it's a robust time. We have an ambitious set of materials we want to share with you today in a very short period of time. But again, opportunities for continuing the conversation in the chat for comments, for questions in the Q&A, and future opportunities as well. So let's get started. Let's just lay the foundation to make sure everyone, regardless of your area of experience and practice, is on the same page. And that is just to clarify guardianship and conservatorship in Minnesota. So we're talking Minnesota law. Every state has their own law about guardianship and conservatorship, and it'll look differently of how it's practiced in different states. But in Minnesota, when we use that term, we are referring to a substitute, or sometimes it's called a surrogate, but most often we call it a substitute decision-making arrangement, where a court has made a finding of incapacity or inability, depending on if it's guardianship or conservatorship, an inability or incapacity to manage one's affairs, and has appointed or has transferred decision-making rights and authority from the individual to that substitute decision maker. In Minnesota, the person who has a guardian is not called a ward. That's a term we used to use up until about 2020, but it's a pretty stigmatizing term. So we don't use the word ward. It's not in our guardianship statute anymore. It still exists in other parts of Minnesota statutes that refer to guardianship and eventually will be phased out. But try real hard to eliminate the word ward from your vocabulary if you're like me and have been around a long time, and it might be stuck in your brain as the term. But instead now we refer to people as a person subject to guardianship. And if a person has a guardian, that means somebody has limited or pretty significant, depending on what's been appointed by the court, limited or significant authority over personal and care decisions. If a person has a conservator, again, person subject to conservatorship, that means a conservator has been granted authority over that person's just about anything related to money, depending on the scope of the powers granted by the court. So income, assets, investments, real estate, financial assets. In Minnesota, it is possible to do a voluntary guardianship or conservatorship as well as involuntary. Most of the time, and certainly the position our office takes and Wings takes, and I think the court takes, the position many of us take is that we would really rarely do a voluntary guardianship for the reason it's nice to not have an objection, right? To not have a contest. But when a person is voluntary, that is to say, I need some help, I want some help, I want this person to help me, very often that's a beautiful transition point to pivot to thinking about less restrictive, non-court appointed ways to help the person. Guardianship is an excellent tool. I really want to set this stage. Guardianship is not going away. Guardianship is an important tool when it's necessary, but as Jamie alluded to, a value of the court and an expectation of the court is that we overall reduce the number of petitions of new guardianships sought, and that we increase the number of guardianship terminations. Again, not going away, necessary tool. Sometimes guardianship is the only way to respond to or prevent maltreatment, significant maltreatment of a person living with vulnerabilities. Sometimes utilizing a guardianship and or a conservatorship is the way. It is accessing, gaining authority to help a person continue achieving their life goals. Indeed, those are true. And because of the enormity, because of the stakes of guardianship, it really must be considered as the tool to be used only in extreme circumstances, when there's just no other way to identify, to address the identified unmet needs of the individual. Truly the last resort. And as times are changing, we are recognizing it is no longer, we must not consider it as sort of the default approach that we turn to when a person has a new diagnosis or a young person with an intellectual disability is turning 18. Unfortunately, for too long in Minnesota and nationally, it kind of, for many people, has been the default approach. And times are changing, and we're changing with that. So let's spend a few minutes today talking about the legal, practical, and ethical considerations of guardianship so we can better understand how and when it's appropriate, and more significantly to our conversation today, when it's not necessary. So legal considerations. And now I want to clarify, I'm not, at the risk of frustrating some, this is not a training on how to petition. If that's something you're interested in, let us know that. Add that in the evaluations in the section where we ask, what else do you want to learn about? So this is not about how to petition, but we are going to talk about some specific legal considerations as somebody might be contemplating petitioning. So starting with the very essence of who needs a guardian, who meets the legal criteria to have a guardian appointed. And we must start with the definition of who an incapacitated person is. And this is this is nuanced, this is modified as of August of 2020 differently than how we used to think about who's eligible for a guardian. As of changes that went into effect in August of 2020, Minnesota's guardianship law truly emphasizes now that guardianship is not based solely on a person's diagnosis or deficits. Instead, it's that combination of the existence of a diagnosis or cognitive, intellectual, or psychiatric deficits. It's the existence of that, but also we have to have specific unmet needs, not something that might happen in the future. This is not a proactive tool. Currently, what are the unmet needs that are unmet because of that diagnosis or that disability? And those unmet needs can't be met in any other way, even when we bring in appropriate technological assistance, even when we bring in supported decision-making assistance. Now, a note for those of you who are watching as opposed to just listening to the presentation, when you see purple lettering on the slides, that is an indication, when I remember to do it, that's an indication that this reflects changes in the Minnesota law as of August of 2020. So you can see here we added supported decision-making assistance to address a person's deficits as of 2020. So what is supported decision-making? We're going to talk a lot more about that later on. But for starters, the Minnesota law defines it now. And this is built into the Minnesota guardianship law. We don't have a freestanding supported decision-making legislation as many states do. We don't have prescribed supported decision-making agreement forms or suggested content in forms. That may be something that happens in Minnesota in the future. But in the meantime, people have the right to say, and they've always had the right, it's just now better explained and clarified in statute, that people have the right to say who they want involved in their decision making, whether they formalize it or not. Again, people always had that right, but it's more clear now. And so our statute defines supported decision making as assistance from others of the individual's choosing in understanding the nature and consequences of potential decisions, be they personal or financial, and that this assistance enables the person to make the decisions, and if they wish, if they communicate that desire, to communicate that decision to others who need the decision. Hold on to that thought, and we'll come back to and spend more time on supported decision making in a little bit after we talk a bit more about guardianship, because they're so intertwined. We can't do one without the other. So again, the legal criteria, who's eligible to have a guardian? Remember, it's a person who meets the criteria that we described a couple slides ago of being an incapacitated person, and cannot, those specific identified needs cannot be met by any less restrictive means, including the statute now gives us even some suggestions, some examples, some prompts to get us thinking about what are some less restrictive alternatives or less restrictive means. That might be technological assistance, communication boards, hearing aids, eyeglasses, anything we can think of technology-wise. It includes supported decision-making. It includes connecting people people to community-based services that they need, that are available, that can meet their unmet needs. Residential services, making a move to a more structured setting or out of a too structured setting into a less structured setting. Appointing a healthcare agent. So these are just some of the examples, and we'll hit on these a little bit more in a few minutes. But critical to know, it's not just the diagnosis, it's also the need. And in fact, as this slide portrays, Minnesota Statute 524.5 in the guardianship and the conservatorship sections both say that in petitioning, so this is an important petitioning consideration, one has to describe in the petition what less restrictive means have been tried or considered, how long they've been tried, and why aren't they sufficient to meet the person's needs. So that has to be described in the petition, and it will have to be talked about in the court hearing, because during the court hearing, the court has to hear sufficient evidence such that if the judicial hearing officer does appoint a guardian, they have to write in their findings specifically to that person why less restrictive alternatives do not work. So this is a new and really strong emphasis on supported decision, on less restrictive alternatives that frankly didn't used to be in the law. It used to be, it mentioned it, but it used to be very easy in both the petitioning and the court hearing to simply say, no, there's no less restrictive alternatives without a thorough evaluation of why not, why aren't they, what has been tried, why don't they work, how long have we tried them. We're not spending time today talking about conservatorship very much. We're really focusing more on guardianship, but conservatorship is always there. Of management, concerns about the financial situation is always there in the background as well. And to round out the conversation, I want to make sure and at least provide you with the information, the corollary, the parallel. It's very parallel information about who's eligible for having a substitute decision maker appointed to manage somebody's finances. And that, again, we have to prove the person is unable. So it's not incapacitated, a slightly lower bar. That's kind of a nuance that some people may or may not latch on to and pay attention to, but have to be able to prove with clear and convincing evidence that the person is unable to manage their finances, even if we bring in technological assistance, including supported decision making and that either their money's going to be scammed away from them, they're going to give away all their money, so we need to control it to protect them, or the opposite. In some cases, we have to gain authority over their finances in order to pay for necessary care and services to make sure their basic needs are met. But again, paralleling the guardianship criteria, we have to show the inability, the unmet needs, and again, that there's no less restrictive way to meet those needs, to provide for either protecting the money or accessing the money to pay for, spend downs, pay for needed care, private pay, whatever the case may be. And so again, the statute informs, here are some examples of less restrictive alternatives that need to be tried. And these really shouldn't be thought of as a comprehensive list. It is an example of some of the most common less restrictive alternatives: helping people informally, getting a representative payee appointed, using a trust, using banking arrangements to help somebody, appointing an attorney in fact under a power of attorney document, lots of different opportunities. Another consideration in contemplating whether to bring a petition is that for young people, effective August 2020, any new petitions brought August 2020 or later, guardianship will now automatically terminate for those people under 30 in 72 months or sooner if the court orders that. Now, caution, this is not a reason for somebody to just rush into guardianship, because don't worry, it'll end anyway. Let's go for it. But it is an opportunity. It is an important consideration. And it's a reminder to all of us that during the course of a guardianship, the guardian, the person subject to guardianship, the other support teams ought to be working towards skill building and relationships and et cetera to ensure the needed accommodations will be in place when that guardianship ends. Again, it's not an if, it's a when. This change in statute goes a long way in helping us all remember and acknowledge that brains are still developing well into mid-20s. Does anybody remember being 18 and some of the decisions you made, or have a young adult kid without disabilities? None of us, nor are most of our kids, are fully ready to launch, fully independent at age 18. And so this section of the statute, and I like to call out our colleague John Kantke, who used to be in the Estate and Elder Law Services, our partner legal team at Volunteers of America, was the author behind this piece. And we think it's just brilliant, and we think it's really helpful and an important reminder that guardianships never needed to be forever, didn't need to be permanent for people of any age, and specifically for the unique situations of younger people, they will automatically expire. Again, I know this probably raises a lot of questions and probably some concerns for people. I'm not going to I don't have time to spend a lot more on this, but I will say, and clarified on your slide here, that if at the end of that 72 months, it is determined or it is felt that the person still needs the protection of a guardian, a new petition can be filed to continue to seek ongoing guardianship for another 72 months and another 72 months until the person is 30. And if it is felt they still need it and can successfully prove it, then it'll be permanent like all other guardianships are, unless the court limits the duration. So that's an important petitioning consideration, by the way, for petitioners for people of any age, any guardianship. We can ask for it to be temporary, and we can ask for it to be less than 72 months. And the court in and of itself can decide to make it more temporary than permanent. These changes in guardianship law are really part of a movement here in Minnesota, as well as nationally and internationally, how we're completely reframing the way systems have historically considered people who have disabilities as requiring guardians. That historical focus on people with deficits and their disabilities, whereas contrast that with newer movements, newer knowledge, newer approaches, the person-centered movements, is about supporting people with disabilities with an emphasis on what they can do, the importance of dignity of risk, the role wishes and goals, or that is quality of life, play in the person, in their life, in service planning and service provision, where it's about adding in supports and services to address challenges, acknowledging and addressing the disability for sure, but not defaulting to guardianship based on a disability or a score or a label. And I like to show these little equation slides to just sort of contrast the change from where it used to be. I've been doing this work. I've been in this position in one form or another since 1990. And I will tell you, for the good part of my career, it truly has been a person has a diagnosis or disability. They can't make decisions all by themselves. They're not wholly independent. So then we label them incapacitated and we say they have to have a decision maker. Whereas, as I've been talking about today, same person, diagnosis or disability, can't make decisions, can't do things independently. By the way, how many of us are 100% independent? I know I'm not every day. But instead of looking at labeling them as incapacitated and in need of a decision maker, we now say, okay, so this is a person who needs some supports to make decisions and arrange for care. And what that means is we, the system, we, the providers, we, the familial systems, need to make accommodations and look at supporting the person in decision making rather than substituting their ability to make their decisions. More on that in a little bit. Before going further on that, I do want to wrap up the guardianship consideration conversation from that practical and then the ethical pieces of it. So practically, lots of reminders, and I could spend hours and hours on the practical limitations of guardianship. It's expensive. It is financially expensive. It is the most expensive option that we have to help support people or to sort of take over support for a person. If an individual is able to pay privately for their necessary care and housing and services, guess who pays for it? Their estate does. That's the petitioning costs, the petitioning filing fees, petitioning attorney, court-appointed attorney, if we're using a professional, independent guardian because there's not family willing or able. All of those costs come out of that individual person's assets. If they meet criteria, in Minnesota we call it, fancy word, informa pauperis or IFP or indigent, or to make it even more layperson, if they qualify for medical assistance or waiver funding. Then they qualify where the person nor the family needs to pay for all of those costs. Sometimes families are asked to pay the cost by attorneys, but statutorily they're not required to. And there are a lot of attorneys out there who will represent families without having to have the family pay the cost. But then those costs, they don't get paid for by the family or the person, but they get paid by public, right? Public dollars, the budget. Budgets set aside significant pots of money towards guardianship, which otherwise could have been used perhaps for more community-based supports, right? So it's very expensive. It's expensive to maintain when we're talking about having to do annual reports to the court, be it family, independent, public, private, whomever, the guardian, independent, have to file reports to the court. And then when they forget to file or don't remember, don't know they have to, then somebody at the court has to be assigned to track who's not filing them, has to follow up with them. The court has to hold hearing dates when we still can't get people to submit the required reports. So this ongoing court supervision to the administration side of it, just getting stuff done and filed in, as well as court hearings ongoing that may come up. It takes a long time to establish guardianship unless it's a true emergency. And it's time and burden to the guardian to keep maintaining it. And as we'll talk about in a few minutes, it has potential for harming the individual. It's also expensive ethically and practically, in that it is removing rights of an individual to make decisions about what happens to them, or in the case of conservatorship, their money, and transferring those rights to someone else. We also want to think about, when we think about, I've got this problem with this person, I care about them, I'm worried about them, they keep engaging in XYZ behaviors, we need to get guardianship so we can protect them, so we can stop the behavior, so we can get them to start behaviors we want them to do, take medications, follow treatment plans, etc. But we have to think carefully before we embark on a petitioning process. If we have a guardian appointed, can the guardian's authority even solve that identified need? We have to remember that the authority of a guardian is significant for sure, but it's really more of a paper power. It's a piece of paper that says a guardian now has the authority. Nothing about that piece of paper is going to change the mind of the individual who now has a guardian to say, oh, you're my guardian. Okay, I'll do what you want me to do, or I'll stop doing what you're concerned about me doing. It's not a compliance power. There's no magic ability other than, yes, a guardian can consent, and a conservator or other fiduciary can pay for care where a person receives their care, so we can consent to a move to a more structured environment, sometimes into a secure or memory care, which is sometimes code for locked environment. So then we're gaining compliance where a person lives. But short of that, and by the way, what happens when we sort of force somebody into that? So short of that, it really is, it's still no more power. In many ways, it's a legal power, but it's no more of a practical power than that family member had before to try to convince the person to do the thing or stop doing the thing. Okay. So it's important consideration. Another thing we have to think about if we're going to go for guardianship to address dangerous behaviors, risky behaviors, bad choices, we want to remember that the person retains significant rights, and those are protected by the Minnesota Bill of Rights, Minnesota Statute 524.5-120, the Bill of Rights for persons subject to guardianship and conservatorship. We're going to talk at future sessions about these issues as pertains to people already under guardianship. And so we'll talk more about rights at future sessions. But today I want to focus for this part of our conversation on the right to personal privacy, which goes hand in hand with the right to, and I forgot to put my purple language here, but the italics show on this slide. This is a section of the Bill of Rights that was modified and enhanced. The person has the right to communicate, visit, or interact with others, including receiving visitors, making or receiving phone calls, personal mail, email, social media, participating in social activities. The guardian's authority only extends to the powers granted by the court. The person retains all rights not specified in the powers, and the person retains, in this example, the right to free association, frankly. It protects the right of the person to interact in ways that they see fit. Oftentimes people think about, I'm going to go get guardianship so I can protect that person, so I can stop them from engaging in dating, so they'll never be hurt, they'll never be exploited by others, they'll never have harmful results as a result of decisions they make about dating and relationships and so forth. But the Bill of Rights and other laws that coincide with guardianship conservatorship laws, like 245D, which governs and licensure of providers of community-based services, that protect fundamental human rights to free association. So this person retains the right to interacting with people. Guardians can restrict that right if they have good cause to believe the restriction is necessary because of an interaction, not because of something that, oh, people with disabilities are more vulnerable. Nope. This specific restriction is necessary for this specific person because it poses a risk of significant, not they're going to get their feelings hurt, or like happens to all of us. If you're lucky if it never happened to you, but get in a relationship that ends badly, your feelings get hurt. It's very painful, sometimes hard to recover from, but that's also human. That's not, in many cases, a risk of significant physical, psychological, or financial harm. So in those, I shouldn't say rare, but in those cases where there's that risk of significant harm, the guardian can restrict the interactions, but only in such a way, only if there's no other means to avoid that significant harm. So we can't even necessarily say you can't have any contact with that person, or you can't have any access to internet or email or social media, but rather how do we modify that risk to avoid the significant harm, which is very different than I don't like the things the person's going to do, or I'm worried they're going to get hurt, right? Important considerations as we're thinking about, can guardianship even impact the area? We also have to think about who can be the guardian. We think about if there's several family members who are sort of fighting with each other about everybody, I know what's best for my kid. No, I know what's best. They're my kid too, or my family member, my parent. People might be fighting over who should be appointed. And the statute has a list of priorities among everybody willing and able to serve. The statute's going to go through a prescribed set of, and may well appoint the person with a higher level of priority even than the petitioner. So we want to think carefully about that. Whoever's going to be the guardian or conservator, there's several background checks. There's several statements they have to report on the petition. And this is important for families who might be very embarrassed to admit. It's not necessarily a deal breaker, but people are going to know it's going to be right in the petition. I've had a bankruptcy in the last 5 years. I've had a judgment against me. I've had my professional license sanctioned for something. So having to admit a number of these background areas. I've ever been substantiated as a perpetrator of maltreatment of adult or child. Whoever's going to be the guardian has to be able to fulfill the annual reporting requirements to the court. A lot of times we professionals talk to families about, you should just be family. It's too hard to be the guardian. You're going to have to make really unpopular decisions. Why don't you step back and just be family? Let us help you find, or you should find, an independent or a professional guardian. That's a consideration too, because the reality is, particularly when we're talking about people who are indigent and don't have money to pay a guardian privately. Remember, guardians are professionals, unless you can find a volunteer. But guardians are professionals. This is their job. And they can't serve an entire caseload of indigent people who can't pay, or for whom a county allows a very small reimbursement for a guardian. So guardians have to be careful about whether they even have any room on their caseload for another case. So that can be a problem, just finding a professional. We have to recognize that professionals, we might think, oh, the professional's going to do things, they'll see eye to eye the way I do, but they may not. Their job is what's in the best interest and considering wishes of the person subject to guardianship. So they may make decisions that are very different with what you, the family member, would hope. Or for that matter as well, for what the person subject to guardianship would want. That person, an independent professional, might not be aligned with our our own cultural values and how we make decisions, how we support people. So there's a lot of potential for challenge there. Minnesota also does not have, we don't have a robust public guardianship system as some other states do, that sort of safety net for people who don't have families willing or able to serve. We do have a public guardianship system, but it can only about 5% of all adults under adult guardianship in Minnesota have the public guardian, because it's only for people with intellectual disabilities who are over 18 and have no one else available to serve, be it a county contract, a private professional, a family member, etc. So that's available only in very rare circumstances. So it can be really hard to even go forward with guardianship, quite simply because we don't have anybody, or all the wrong people are vying to be a guardian, or nobody more likely available to serve. So then we turn to ethical considerations as we're contemplating petitioning. And these are some pieces that are hard to hear. These are some pieces that sometimes make us feel a little defensive, but it's necessary to hear them. It's necessary to think about them. We sometimes think we're going to use guardianship. We sometimes think it's the best tool because this person is vulnerable and we need them to be safe. But the unfortunate reality is guardianship can also promote a false sense of security. Sometimes we think just by having a guardian, remember we talked about compliance versus consent power. Sometimes the thought is, well, I'm the guardian, so I'm going to say they can't do unhealthy things like smoking, like eating sweets for the majority of their. I'm going to tell you, my diet's not the most healthy, and I understand what that could mean to me long term. But how would I feel if someone else is empowered to make decisions so that I'm only eating a healthy diet all the time, every meal? Guess what? I'm going to sneak around and I'm going to find a way to get, whether my preferred junk is salt or sugar, I'm going to find a way. A guardian's going to stop me from smoking. I'm going to find a way. I'm going to be pulling cigarette butts out of the gutter or out of the community ashtray. I'm going to sneak around to access internet dating or dating in person because I'm a human being and I have needs for intimacy, even if I've got some disabilities. I'm a human being with intimacy needs, and I'm not allowed to do those things. Guess what I'm going to do? I'm going to sneak around, and I'm not going to tell my guardian or anybody. And then how much more dangerous might it be? Sometimes when people are placed under guardianship, we think, oh, that's that. They're safe. We're no worries anymore. And then we don't keep working on skill building. Sometimes we, the guardians, family, professionals, systems, we have low expectations of people who have guardians because we assume they have a disability. Sometimes we even refer to people with disabilities as, well, they have an age functioning of a second grader. And so therefore they're not an adult. And we don't have, and they're like a second grader or a 7-year-old we hear. And so that person couldn't do, possibly a 7-year-old can't do these things. So I will never expect that the person I'm concerned about, this adult who has a disability, who has needs for support, I'll never have higher expectations of them because they're like a second grader. Right? And then therefore that person never gets a chance to learn good decision making or even recognize danger because we don't let them experience appropriate levels of risk to learn from that. We just think we're eliminating risk entirely. And again, then people aren't even recognizing danger. Okay. The risks that it brings to the person when we label people or when we build structures around them saying, I don't know if you can do that. I have to ask your guardian. Because you have an incapacity, you have a guardian, you can't decide. And of course, we're not necessarily saying some of those things as directly as that. It's more subtle and nuanced. But all of that can lead to, for the individual, really a decreased sense of self-worth. Again, less focus on growth and skill building and keeping a person vulnerable, ironically, when we're actually trying to keep them safe. And when we're doing all of these things, when we are taking care of a person, we're ascribing powers to someone else for their own good, that loss of sense of self, that sense of agency, that sense of I'm in charge of my life, really can lead to increased resistance. I've picked these pictures very specifically, that anger folding inward or turning away from us, decreased cooperation. And what are those things but behaviors? I just saw a great, and I shared it on my LinkedIn post the other day, a great meme, which I won't be able to articulate at this moment, but something along the lines of diminishing my human dignity, my ability to be recognized as a human being is what rage results in rage. That's what rage looks like. That's the result of rage. That's the result of behaviors. And what happens when people are labeled with behaviors? More likely to request medications, more likely to move people into increasing levels of structured living environments, which leads to more resistance, more loss of self-worth and self-esteem, and just a dwindling spiral of risks. This is something we don't think about often, or at least I guess I'll just speak for myself. Historically, I didn't used to think about this very much. Or if I did, I thought about, well, yeah, but what's more important is safety above all. When in fact, when we think we're protecting people and enhancing safety, again, what we may be doing is increasing the risk of abuse. People who don't have a sense of self, loss of self-worth, aren't taught skills, aren't thought to be capable or thought to be likely to interact in the world, less likely to recognize abuse as abuse. We often don't teach people the difference between appropriate, intimate body self care versus when it crosses a line into abuse. Less likely to report, and when they do report, less likely to be believed because of their diagnosis, because of their status as having a guardian. We have cultures of compliance and learned helplessness. People who know a lot more than I do about working in the fields of working with people with intellectual disabilities know and will state how we sort of groom people. People themselves recognize if I'm more pleasant and happy and engaging and going along and accepting everything, people like me better. So we have this culture of compliance and learned helplessness, which can again increase abuse. So bringing it all home. If we're thinking about petitioning, have we met the statutory criteria, which includes, can needs be met in any other way? Does the need for protection justify the removal of the person's rights? Important. Does the need for protection outweigh the harms and unintended consequences of the intervention? And what will happen to the person in terms of their own symptoms or issues or behaviors and the worse outcomes, just from the fact of going through the process of being labeled incapacitated, getting neuropsych testing, going through the court process, having a guardian. So we have to very careful weigh these out, that court intervention is always the last resort, that when we can be creative, open-minded, exploring less restrictive approaches, exploring full continuum of decision-making options, considering seriously how the guardianship decision will impact a person's care and safety, quality of life, and how they'll react to care and safety interventions. These are the things we must focus on. So thinking carefully about avoiding unnecessary guardianship leads us to the conversation of less restrictive alternatives. And you remember from the statute earlier, or you can refer back, the statute provides us several examples of less restrictive alternatives that ought be tried and ruled out, but there are a whole lot more. We can be very creative in building together one, some, or all of these approaches, building a very complex quilt of services and supports to help meet the person's unmet needs outside of the imposition of a guardian. And these can include, by the way, a person accepting services. We hear pretty often somebody's willing to go into to receive the care and services that other people are recommending, but someone says, oh, but they don't understand it fully, so we have to have a guardian to consent. Not accurate according to our statute, right? Supported decision-making, working with other people, formally or informally. Appointing a healthcare agent, that's a pretty critical way. We don't have to have a person with capacity to understand a complex medical decision and how the range of suggested treatment options impact their current clinical condition and their future life goals. That's a high level of complexity. But if a person can identify, I want that person, I want my mom, my sibling, my best friend to make decisions for me if I can't make my own in the realm of healthcare, that's probably sufficient ability to appoint a healthcare agent. Getting someone in charge of the money, getting somebody in charge of receiving the SSI through representative payee, paying the spend down, paying the bills, helping budget, and then the person can safely manage the leftover money. The role of the county case manager or a private pay care private pay care manager can go a long way to being that gatekeeper. So there's so many different options to avoiding guardianship, avoiding conservatorship that we can build in. It's the right thing to do. By the way, it's required by law. It might feel more time intensive, but in the long run, the results are enormous. Protection of rights, better outcomes, preserving relationships, less costly to individuals, to counties, to public systems. So how to decide? That gets to the crux of it. And frankly, we need several more hours to talk about how to navigate through those decisions. But we do have a few tools available to you. I'm not going to go through step by step, but I did share some screenshots with you. And in the handouts you're going to get access to these tools that I'm sharing now. But this first one is a tool that was developed. We call it a guardianship decision tree. And it was developed by the Department of Human Services with significant input from WINGS members and the Center for Excellence, where I'm from, to just walk through step by step. Is guardianship necessary? Step by step, starting with why are we even thinking about it? What's the root cause for the request? And if there aren't specific needs to be met, stop right there. We don't go further with the guardianship, but just walking through what's the specific decision. We don't just do it because they might someday, or generically people with this disease can't, but rather what's the specific decision? Can the person be involved? Can they communicate a preference in their decision? So going through step by step to sort of weed out, stop thinking about guardianship and try other opportunities, or continue through the process. And then ultimately, if it is determined that guardianship is the only way, then ideally accessing an attorney to help navigate. Attorney's not required by law, but very helpful. And trying to involve the person in the process throughout, before the guardianship and then after the guardianship. Again, person-centered guardianships are a different conversation than we have time for. Another excellent resource is the practical tool commissioned by or developed and published by the American Bar Association several years ago by and for attorneys, but it's really accessible and applicable. And again, I've given you links to these. I think these are really helpful, be you a family or a professional who's contemplating guardianship. It has people walk through several stages, 9 to be specific, each indicated by a letter in the word practical, to think through, for example, the very first one, the base element. Start with the presumption that guardianship is not needed. That opens our eyes to finding other ways. We sort through what specifically do we need in why are we thinking about guardianship or conservatorship? Is it about money management problems? Is it about healthcare issues, relationships, community living, et cetera? And when we walk through specific reasons for it, we're going to, in the other stages, we're going to evaluate, are there causes of those deficits that are treatable or reversible? What else is available? If we presume guardianship's not available, what else can we build in to address the unmet abilities in healthcare decision-making, relationships, community living, et cetera? And then the other resource in the moment for people is the statewide guardianship information line, which our office hosts. This is a free email, phone, sometimes video chatting. We have a monthly virtual drop-in clinic. This is an opportunity to consult for individuals, professionals, or families about your unique situation. So those are some tools. If we pivot to supported decision making, and I'm just going to wrap this piece up and then toss the baton to my co-presenters today to tell the real story of supported decision making. But before we do that, I just want to frame it a little more. Now, this graphic is kind of hard to read, but you have it. It's going to be provided in your list of handouts. This is a great tool that helps walk through essentially everything we're talking about today. What is supported decision making? It's a empowering, skill building, transformative approach to helping people. It preserves rights. It builds on existing capacity with real life experience and learning. It acknowledges currently what happens now, or soon we can say what used to happen. When there's a guardian, there's little to no emphasis on teaching decision-making skills. We might be stuck with low expectations about decision-making in meaningful ways. We might have a bias towards guardianship. What can we do? How can we rethink how we support people? That's the essence of supported decision-making, and I just love this tool so much, and so I wanted to make sure and give it to you and remind myself to tell you that you have it as a handout. It's also a great tool to help teach other people, because this is a big concept to try to attend a training and hear about it maybe for the first or second or third time and then try to explain it to someone else. So that tool is really helpful tool. This is all about, again, thinking differently about how we support people with disabilities, thinking about people can learn from mistakes and poor decisions, looking differently about what happens when we bubble wrap, I call it bubble wrapping people into total safety, total risk elimination versus the benefits to that human being of the dignity of risk. That too often when we restrict something for safety or health reasons, good reasons, well-intended reasons, but sometimes that can lead to worse consequences. We know this anecdotally, and the research backs it up. Plethora of research, just kind of gathered all in one slide here. But we know from research, and again, anecdotally, that people who experience greater self-determination are healthier, more independent, more likely to live in community settings, more likely to be gainfully employed rather than in more of those, what we used to call sheltered workshop situations, in competitive employment situations, better able to recognize and resist abuse, more well-adjusted even to the changing needs that they have for extra support. When we think about it, the benefits of self-determination, we think about supported decision-making, I like to give some additional definitions because I think each of the definitions, the legal one in Minnesota statute is important to help people understand it is required by law, and this is a definition, but also to help people understand a few different ways of looking at what supported decision-making is. And this quote or this definition from Professor Peter Blanc and Jonathan Martinez. Jonathan Martinez is the sort of the national face, professional face of supported decision-making because he successfully represented a young woman with Down syndrome in the mid-2000, the 2013-ish era to help her get out of a well-intended but overly restrictive guardianship and move into a supported decision-making arrangement. So he gets to have lots of the background and lots of the kudos and the support and the acknowledgement, and he gets to author books and write definitions. So his definition is a recognized alternative to guardianship where people use trusted friends, family, and professionals to help them understand their situation and the choices they make, so they can make their own decisions without the need for a guardian. Now, those of you who are both listening to me and reading the slide, notice I left out the phrase people with disabilities, and I did that very deliberately. And I'll come back to that in a minute. Another great definition is by the advocate Robert Dinerstein, who I think lays it out just so beautifully to say it's not any one thing, it's everything. It's a series of relationships, practices, arrangements, or agreements of more or less formality, more or less intensity, all designed to help an individual make and communicate decisions to others about decisions for that person's life. So it really comes back to that reminder. There's no one way to do it. If you're sitting here feeling frustrated with, oh, she's about to wrap up her time and she didn't tell me how to do it, that's because there isn't a checklist of step by step. It's everything we do. It's a way of thinking differently about supporting people and whether they need a guardian. And it's everything we do, big or small, formal or informal, to help people understand the situation so they can make the decision. And as Jonathan likes to say, if you ever listen to him, he'll say, and I quote, I was an idiot when I wrote that definition. He said that's human decision making. It's not just how people with disabilities make decisions. We all need help, big or small, frequently or infrequently, from others to be who we are, to get where we are, to make decisions that are complicated in our lives. So supported decision-making agreements, written formal agreements, are not required. A lot of people prefer, and frankly, sometimes it's fair to admit that some providers, healthcare providers, social service providers, they may be more inclined to accept the legitimacy of a supported decision-making arrangement if it's in writing. In fact, I've given you one of the handouts is a sample form because Minnesota doesn't currently have a form as many other states do, but we're working on developing a suggested form. But in the meantime, again, our office in partnership with John Kantke of formerly of Estate and Elder Law Services developed an addendum, a healthcare decision-making addendum to the healthcare directive. Sometimes if people attach that to a form that doctors do already recognize and honor and accept, maybe that will enhance people's willingness. But again, it shouldn't have to be, because again, I'm Anita Raymond. I do or do not have a disability, but I have the right to say, I want this person to be able to come with me to the doctor's appointments. You don't get to just shut them out and say this is private. I want them in there. They get to be here with or without me formalizing that. I want them to talk to the doctor with or without my presence. They get to do that. And again, I'll probably have to sign a release of information. But we have that right before it was in the law. Now that it's in the law, with or without a piece of paper. Those of us who want to do a piece of paper, because that's helpful. There's some really helpful planning guides, talking points to get to have a conversation among family and an individual with a disability to come up with what areas of help do I want and need. And a lot of those are available on the National Resource Center for Supported Decision Making, which is their web address is listed here on this slide. So it all comes down to, before I turn it over, some important pieces I want to say. This is not about somebody has a guardian or they don't, and we just leave them to their own devices. They're their own guardian. And by the way, I hate that term, they're their own guardian, because notice I didn't say I'm Anita Raymond and I'm my own guardian. We don't say that about ourselves, but we say it about people with disabilities. How about somebody has a guardian, somebody doesn't have a guardian? That person has a guardian, that person is in charge of their own decision making. So, but that's a tangent. It is not, we have a guardian or we have nothing. And when we have that idea, of course, we're all going to go for guardianship. But that's not the reality. The reality is it is it's a balance. It is building in safety nets, having those trusting relationships, building community, all about helping the person reduce risk, skill building, but having those scaffoldings, having that lifesaver, that safety net, or the catching hands if somebody does run into trouble, having that trusting relationship, which by the way is hard to maintain in the adversarial process of getting a guardian, having that trusting relationship where the person is willing to go back. If I come to you with a problem and I know that admitting I made a big mistake means you're going to take away my driver's license, you're going to put me under guardianship, you're going to make me move, I'm not going to come to you when I made a mistake. But if I have that trusting relationship where I know we're working together towards skill building, I'm going to come to you when I've got a problem or hopefully before a problem arises, right? So this is about building in those safeties and support, not just no guardian, so therefore whatever happens. That's not what we're talking about. In our office, we talk a lot about the phrase, and I always credit Kathleen for bringing it to our attention, the phrase as safe as necessary. Not as safe as possible. As safe as possible gets us back to that bubble wrap, right? But as safe as necessary. Modified risk, appropriate levels of risk. And again, to quote Jenny, I don't need a guardian, I just need a little help. So that's what I want to tell you about guardianship and supported decision making. And now I'd like to have Jean and Mary join us. And I'm pretty sure Jean is going to, I see Alicia coming up there. So before we do that, but getting close to Jean and Mary joining us. Hi, Jean. Thanks for coming on camera. Very quickly, Alicia, do we have something we should cover before pivoting?
Yeah, we've had wonderful questions. We have a few that we'll save to the end, to the Q&A. But there are a few questions about supported decision-making that I thought would be good to cover before moving on to that next step. One person asked about the liability in supported decision making and if it opens up any risk for the person that is assisting or helping the individual. And then another supported decision-making question was, if the state is encouraging models like supported decision-making, does this mean that the state will be directing new funding towards agencies who engage in supported decision-making? There's a few other questions. I'll leave those for the end.
Okay. Those are both excellent questions. So the liability question, I think similar, so I'm not a lawyer, and I know we have some lawyers listening, so we might enjoy some of that. And Mary might have some things to add about when they had some of those conversations. But bottom line, I think, I mean, we all know we live in litigious societies. Anybody can bring lawsuits. Generally speaking, I believe what will happen is good faith involvement in the person's life, just like our guardian's liable if things go really bad. They are. If the guardian was neglectful and not doing their duty, they have some liability and something bad happens. But generally speaking, am I liable because I help my mom? I don't have any legal authority to help her, but I help her a lot and I support her. And yes, something bad could happen to her living in her apartment. Maybe even other people in her apartment if, heaven forbid, there's a fire. Am I personally liable? Well, somebody might argue I am, but if I'm doing good faith efforts, we ought not constrain our concerns about liability into, therefore, I'm worried about liability, so I'm going to take away that person's rights because then I'm not liable, right? So I'm not answering the question directly, but that's a concern I hear a lot, and that's a concern I hope doesn't stop us from moving forward. With promotion and changing ideas and practices and statutory requirements regarding supported decision making, are there going to be more funding streams? Stand by. That is the hope. We need funding to help pay for professional supporters for individuals who choose not to or don't have family to be their support, and they don't have money to pay privately to have somebody help them navigate through their health and so forth. So we need funding to help pay what hopefully down the road that's going to come through waiver funding is my hope. Not there yet, but that's my hope. We do need that. We need funding to pay for services like the Guardianship Information Line and the kinds of trainings that our office is providing. That funding is absolutely essential because there's no capacity right now to fund the kinds of services that are existing, and we're all busy looking towards. In fact, there's some groups forming to look into funding strategies across the board for supported decision making. Okay, I hope that sufficiently answers. More opportunity later, and I would like to turn off my microphone and welcome Jean and Mary. And I believe, Jean, you're going to go first. Is that right?
Actually, I'll go first, and then we'll present in tandem. Thank you. Thank you, Anita. This is Mary talking. I'm a white woman with brown hair wearing a slate blue sweater with flecks of color. I'm sitting with a bookshelf behind me. I'm a parent of 4 young adults, ages 19 to 26, whom my husband and I continue to support and parent. We are transitioning into the role of coach and mentor as each one is increasing their independence and living the life of their choice, their best life. We have had the same expectations for Jean and her siblings. Our hopes and dreams for Jean has always been to pursue her strengths and interests, go to college, and live her best life. A critical component of parenting all of our children has been equipping them with confidence and decision-making skills and not shielding them from experiencing natural consequences. Learning comes from mistakes as much as successes, and this is really a description of dignity of risk. The dignity of risk is the right of a person to make an informed choice to engage in experiences meaningful to him or her and which are necessary for the personal growth and development. Everyone encounters risk in their everyday lives. People with disabilities are no different. We support Jean's independence, and we're striving to empower Jean to make her own choices.
I am a white woman with brown hair. I am in an office at ICI working today. I want to live on my own, live and make my own decisions. I have a centered plan to help me with my goals. My family, friends, and coworkers supported me. Sometimes I need help like anyone else. I like to understand my options and make an equal choice.
I first learned about supported decision making through Barb Kleist. I met Barb through the ARC Minnesota, and I've always tried to proactively stay ahead of the next age and stage of Jean and her sisters. In addition to researching supported decision making, I also had the opportunity to attend presentations by Anita Raymond as well as Jonathan Martinez. This was several years before Jean turned 18. As I gained a better understanding of supported decision-making, I knew that this was a path forward to support Jean as she turned 18 and grew into adulthood. It also helped as we advocated for and with Jean, as there was pressure from educators and social service providers who were directing Jean and us to the path of guardianship. I shared information with Jean so that she could make an informed choice before she turned 18. She chose supported decision-making over guardianship. As with all our children, we helped Jean plan for turning 18 and putting in place the necessary legal documents.
My mom explained supported decision-making to me. I like the idea of making my own decisions. I feel comfortable knowing that my parents will be there to help when I needed it. My mom helped me find an attorney that understood supported decision making. I met with him to talk about what legal documents I needed as an adult, and if I wanted to use supported decision making. I needed a power of attorney, a healthcare directive with special advices for supported decision making, and I was taken to release confidential information. Under a supported decision making agreement, he helped me decide who to include in my document and the choices that I need to make. After he prepared my documents, I met with him to review and sign them. My parents attended the meeting with me. I have an appointment my parents as my supporters. They help me make decisions. I have other family members and friends who sometimes talk to me when I am making a decision. It is my choice to have my parents as supporters. I can change my choice when I want to. The areas in which I get support included going to the doctor. My mom goes with me to my doctor's appointment. She helps me prepare a list of questions or health issues that I want to talk to the doctor about. Me appear. She does not stay in appointment for the whole time. I have started to change my doctor's receipt from pediatricians to adult doctors. She is helping with the transportation. I make sure that my healthcare directive and organization to share confidential information are in my medical records. Traveling. I decided to go to college out of state and travel by airplane. My mom and my Pittsburgh friends supported me to be flying independently. I am also starting to use Uber and Lyft while traveling and for the work. financial decisions. I need to start with my banking and financial discussions. My mom and dad help me. I have and use a debit card. I'm also using the SSA app to report my monthly income. Motor distance. My parents help me with big decisions. I want to go to college and they supported my decision. My mom helps me appear for and supports me during meetings with my case manager, for medical rehabilitation counselor, and the SSA staff. It is my choice to have her support me, and I give her permission to talk on my behalf if I get stuck. We work together. All my doctors have accepted my supported decision-making doctor. They see me as their patient and my mom as a supporter. I have not had any problems so far. At college, I was on my own advocate. I made my own decision like everyone other college student. My mom was able to support me when I needed it. I had the support of my advisors, professors, and mentors. I also had the support of my Pittsburgh mom. I have SSI. I needed to meet with the SSA office to require an express. My mom has been with me and helps with medication. She helps me prepare questions or the information that I need to report. She supports me when I make telephone calls or use the recording app. If I need to, I give the SSA person permission to talk directly with my mom. We do this together and she makes sure that I understand my choices and what I need to do. I like to vote. I have voted in every election since I turned 18. I get ready to vote by looking at the stable ballot and learning about the candidates. I make my own choices on whom to vote for and complete my ballot on my own. I have not had anyone question whether I am able to vote or if I should be voting. Every vote counts pretty much.
So we look at Jean's life experiences through the lens of what is typical for anyone of the same age. We celebrate Jean's experiences, growth, and development like her siblings and peers. We recognize that she may need additional support, but we individualize the support that each of our children receives from us based on what their individual needs are. This recognizes Jean's independence and capability. It gives her the room to grow as well as fail, the dignity of risk. She is a capable, lifelong learner. As her supporters, we provide her with the scaffolding to gain in her independence and achieve her best life. Jean has many relationships that provide her with the network of support that we all need in life.
Living on my own life is what I want to do. It is not scary to make my own choices. I feel good about myself. I feel empowered to be advanced in action.
I believe in supported decision-making as an option that Minnesotans with disability and their families should consider.
I testified at the state capitol and helped change the Minnesota guardianship law. I like to advocate. I like to make my own choices. I hope that more Minnesotans with disabilities learn about and consider supported decision making. Thank you for listening to our experience.
Thank you so much, Jean. I really appreciate it. And I'm sure our attendees are so grateful to hear your story in your own words and to meet you, Mary, as well as a strong advocate as well. I remember that day also well, on that spring day in 2020 when we all met at the house and introduce the bill, and hearing you two testify. And I know I was very moved and pleased, even though you and I had met before, Mary. I think that was the first time I met Jean, and what an exciting time that was. And there's other folks in the photo, other advocates, other parents, also who were all there. What a fine day that was, and how exciting several months later when supported decision making was signed into law with the guardianship statute changes. Let's pivot. We've got about 15 minutes left. This is a great time to have more conversation. I know it's hard to have conversation in this webinar format, but with the help of Kathleen and Alicia and Jamie with the chat and Q&A, and while they're polling up some of those, I just want to run through a few other things for you all to know. We will be doing another webinar through Wings on similar theme, but aimed at audiences where there's already a guardianship in place. That will be coming up. I think we have a date set, but I don't have the date in front of me. And then I will also be partnering with the Minnesota Elder Justice Center. You may know, if you don't, look them up. They have almost weekly webinars on a plethora of topics related to justice issues and rights issues. And a couple of notes, in December, we'll be doing parallel webinar to today's, only we'll focus more on the older adult audience. And then again, that same one that we'll do in the spring for Wings of what guardians should know about supported decision making. So these are some upcoming opportunities for more conversation. Again, our language about thank you to the judicial branch and ACL for bringing this training to us, opportunities to connect further with our office to talk more about your questions. We also have some great resources on our website as well as on the Wings website, including some really great and fun explainer videos. I'm going to just keep going past. If we have time, we'll talk more about those videos. Some great booklets, best practices in supported decision making, how to be an effective supporter. We're particularly proud of that document that we published last year. And then just great resources available to everybody. Disability Hub, Senior Linkage Line. The Elder Justice Initiative has developed Finding the Right Fit training, and lots of resources. And if you found your way to this webinar with a direct email from Wings, congratulations, thank you. If somebody forwarded you the information about the webinar and you want to make sure and not miss future news and future webinars, make sure you sign up and subscribe to the newsletter. I will stop sharing unless somebody wants us to go back to a particular slide. Where are we with questions and conversation?
We have had wonderful questions and conversation in the Q&A. Let's start with, I'll first start and say that Zoom sent an email to all participants yesterday with a link to the Google Drive where Anita has shared all the resources. You can also reach out to us if you need contact with that. We have a few questions. The first one I'll ask is, somebody said, can you please clarify those that have had a guardianship conservatorship, but the current guardian wants to be released? When is the new guardianship granted? When the new guardianship is granted, will there be a 72-month waiting period, just like in the first petition?
Okay.
like there would be if it was the first petition.
Right. So guardians are released when they have gone, when there's been a petition and a court hearing, and the court has ordered either the appointment of a successor, termination of the guardianship. Those are the ways that the current guardian is released. Any new petition brought for a person who's younger than 30 now, anytime after August of 2020, will be applicable to the 72-month limitation or expiration if it's a person under 30, even if it's a successor, is my understanding. I'm not a lawyer, but that's my understanding.
Thank you. And this question may be for Jamie. For individuals that are looking to become a guardian or are a guardian, is there any required training or available training for people to learn about being a guardian?
There is currently no required training, but there are some trainings that are available out on our website, minnesotacourts.gov. If you search conservatorship or guardianship, it should bring you to our page, and then you can click on the training and resources tab, and then there'll be a few listed for you.
Thank you. More of a comment than a question. We had somebody say supported decision-making information needs to be given to 17-year-olds and their parents and caregivers from the high school special education teams, especially when they're mentioning guardianship. That is definitely something that
lots of head nodding. If you're just listening, lots of head nodding in that silence.
Yes, it is something that should
Mary,
be shared widely.
Is that anything you would want to comment on, Mary or Jean? I think you had alluded to, you felt a little pressure. People kept mentioning you should go down that road.
It was really a presumption that we were the ones that discovered and learned about supported decision making. That was not something that the IEP team or any of the educators had any knowledge of, and so we brought it to them, and simply just explained if and when it ever came up about when Jean we were gonna go through the guardianship process with her, that we simply were not going to do that.
Thank you. So my hope is we have at the moment 242 people with us. I'm hoping we'll subtract 6 here. I'm hoping 236 of you consider yourselves at least a tiny bit, if not a strong advocate and ambassador for supported decision making. Take this message back to your families, to the systems you interact with. We are working very hard collectively to get these messages to special ed, to legal professionals, healthcare professionals, social services, but also we can't do it all. For all the trainings we do, there are tens of thousands of Minnesotans who need to hear this message that we can't get to. So hoping you all too will help us share that message.
Great. Yeah, that was another point that was just brought up, is continued education that people can watch out for from WINGS, in the belief that more and more people turning 18 or more and more people potentially subject to guardianship need this information. And indeed, it is a changing conversation, and this presentation, this ongoing education, is something that we do ongoing. So stay in touch with WINGS and the Center for Excellence in Supported Decision Making. Another question that was posed, I'll read it out loud here. I am more concerned about the lack of responsibility and accountability of the person providing support in a supported decision making model. As a single parent with a young adult who doesn't connect with too many others besides me, what protections are there out there if something happens to me? Without a court order, what guarantee will there be that someone steps up and provides that support? Is there a way to provide that in a formal way? So Mary, it may be a question to you of long-term support that you're seeing for Jean and supports that you have in supported decision-making, or just thoughts about that question and that long-term help for caregivers.
Yeah, fortunately, Jean has 3 siblings, and we've talked about that, right, Jean? And that, my husband and I are not going to be her supporters forever. And so that's part of that network and that social capital that we're helping her build, so that we kind of age out of it, if you will. And that's going to be determined a lot by Jean as to the timing of when she's ready to have other people be supporting her as opposed to her parents. And then just having those conversations with that inner circle, if you will, of friends and family, so that they're aware and prepared, and they know what her wishes are and what our hopes and dreams are for Jean to be an independent adult.
I'd like to also add to that too. Thank you, Mary. That's exactly what I would suggest too. It's building those communities now. And I just want to clarify, even if you have a guardian, if you are a guardian, the person asking the question, if you're the guardian and when I mean, we are all going to experience life as a terminal disease. When that time comes, there's nothing that automatically happens. Still, someone has to notice that you're unable or deceased and bring it to the attention of the court, and then finding another person. And in conversing with other families who are in this role and making that decision, for some families, that's the deciding factor of, I don't want guardianship because I perceive it's going to be a lot easier to convince my kiddos' siblings to step in, or my siblings or cousins to step in and help informally, than it's going to be to find somebody to step in and be the guardian, because just that title, that role, that responsibility, that's overwhelming. And so paradoxically, it can be easier to find people to support when you're no longer able, if you're informal versus guardian.
I would like to add one other thing, just as the example, when Jean made the decision to go out of state for college. So she actually was just out of state for a semester just because of COVID, but we didn't have any connections in Pittsburgh where she was. And so we developed over the year and a half, 2 years, those connections. And then locally, and as she had shared in our presentation, her Pittsburgh mom, right? That was another family that we met. And so that she was building support there locally, so that it wasn't just relying on me 14 hours away, but she had the campus community as well as the broader community in terms of other families that we had gotten to know through college.
As Anita says so frequently, people protect people, systems don't protect people, right? So if we can build a strong, robust network of people that we trust, that's often the best guarantee, and sometimes only guarantee to safety. There is a question here about the legal authority of supported decision makers. Do supported decision makers have any legal authority?
I'm pausing in case I see Mary's brain turning. So I'm going to pause and give space for answering. In the meantime, I will also say again, because there's no presumed requirement to act. Again, I'm helping my mom. Do I have legal liability or legal authority? No, it's a familial, community-based relationship.
And we are Jean supporters. And it just is a little bit more formalized than, say, for her siblings, right? Because we really are truly in that role of advising and coaching. With each of our children as they turn 18, we helped them get all their legal documents in order. So that if something were to happen where they couldn't be making decisions on their own, then they had their wishes in place, and then we could follow through and just happened that all of the documents right now name us as some of the key players or key responsibilities if they're incapacitated in one way or the other to not be able to make decisions on their own. But that'll navigate or transition to other people as they get older and move on with their lives.
If someone already has a guardian, is it still a good idea to do supported decision making? And can you still do supported decision making?
Okay. Again, I'm pausing. I don't want to jump in, but I'll jump in. So here's my take on it. Supported decision making is always, always, always making decisions with the person, not for the person, unless the person says, please make that decision for me. I do that to my husband sometimes. Please just decide. But supported decision making is making decisions with someone. A guardian can do excellent work, can be the most person-centered, can be informed by ideas of supported decision making, can value dignity of risk and those kinds of things. But ultimately, a guardian inherently, legally, by definition, has decision making authority over the person. So the guardian always has authority to override the person. So I would argue, and I didn't put slides in, but I do have some slides that suggest that there is not an overlap between supported decision-making and guardianship. They're both person-centered approaches. Guardianship should definitely be thinking about supported decision-making and being creative to think through, if we can build in supports, can we terminate this guardianship? And a guardian can involve a person and seek extensive input and help a person gradually grow to be more capable of making decisions independently. But until that guardianship or that guardianship power is terminated, the guardian is still has authority to make decisions for the person. So there's not an intersection. It's a side-by-side thing. That's my opinion. I have heard national experts disagree. So others can disagree on that. That is the position I take. We are at 1:30. I'm comfortable. I'm going to guess the numbers are going to start dropping because people have busy days. I think we can stay on a tad bit more if there's a couple questions, Alicia, that it feels like we should really be sure to hit if people want to stay on. And I don't think Zoom will just end us, but if they do, goodbye and thank you all for your attention and attending. And please, please, please do the evaluations.
We have just one more question here. We were able to get through all of the questions, which is wonderful. This one is specifically a question about guardianship, and I think it would be better suited if I just answered it on the guardianship information line. It's about being financially responsible for guardianship. So I can make sure to answer that one. Another question just came in is, when is Minnesota going to make some type of legal supported decision-making for medical only?
And then a follow-up, medical is the biggest concern. Yeah. So I'm not clear exactly what that decision or what that question is asking, but I will say again, it is in statute, supported decision-making. We cannot bring petitions for guardianship. The court ought not be appointing guardianship, even for authority over medical decision-making, when that person's needs can get met by having someone else help them understand their medical decision. It is in the law. It's the definition is in the law, and the statutory requirement of trying less restrictive alternatives, including supported decision-making. So perhaps implied in your question is that we need to be educating healthcare providers that it is acceptable to turn to families informally, exactly like we heard Jean and Mary do. We don't get caught up in diagnosis equals unable equals has to have a guardian. Thank you so much for the feedback that's coming through. Yeah, hard enough for medical providers to talk to limited guardians. It's a problem, and I hear a lot of families, there's a lot of fear-based, we have to go get guardianship because doctors aren't going to talk to us anymore. And that's just a fallacy. That's a fear. That's pushing people. That's the presumption of guardianship. And as Mary talked about, we get around that with the patient. The individual has the right to say, I want this person to help me. And by the way, here's a release of information. And by the way, here's a healthcare directive. And by the way, just because I have a disability doesn't mean I can't appoint someone as my healthcare decision maker if you truly believe I'm not capable of making that particular medical decision. All right. Well, thank you so much for your attendance. More information to come, more webinars to come. Thank you, Mary and Jean, for sharing your experience. That is just so enriching and goes far beyond what I can blab about from the professional perspective. So thank you all. Bye-bye and happy Thanksgiving.